Now, some experts are also concerned that this bill could have a ripple effect on healthcare systems around the country, and that includes Hawaii's Medicaid recipients. Tonight, we welcome our newest member to the team, Gil Kano, who has our top story tonight. And Gil, just how many people in Hawaii could lose access to healthcare if this bill is passed?
400,000 people out of our state's population of 1.4 million rely on Medicaid for coverage. That's nearly 30%. If you're covered by Aloha Care through Medicaid, you could lose access, but just know you'll have options. As the House of Representatives votes on President Donald Trump's spending bill, nearly 1/3 of Hawaii residents on Medicaid sit waiting to see if their families will lose access to health care. Aloha Care says they're preparing.
You may know that community health centers will see people regardless of their coverage. And so we're gearing up with our community health centers to be prepared to be there for people who might be affected by any of these changes.
There are 17 federally qualified health centers in Hawaii. One is already looking for financial solutions.
I think we have to look at alternative sources of funding to serve people, maybe grow the ratio of federal funds away from the ratio of federal funds to other support. We've been pretty good in the past of raising dollars and doing development programs. So our intention is not to cut services, to continue to serve people.
Typically, a grace period is granted for children on Quest or Medicaid until the end of the month in which they turn 6. For children ages 6 to 18 on Quest, their coverage is locked in for a full 24 months. How permanent these details are, if the bill is passed, is up in the air.
We're still learning all the rules around this, but it looks to me like there's an exemption for children from working, the work requirement, plus adults that have children under 13 years of age. Now, in terms of the 6-month re-enrollment requirement, I've not seen the details on that yet.
Nearly 70% of people on Medicaid have jobs. Hawaii Congresswoman Jill Takuda voted against the bill and says it will take away from Hawaii residents.
I will tell you, people on Medicaid, people receiving SNAP funds, these are hardworking folks back home in Hawaii, and we will see hundreds of thousands of people impacted if these cuts go through.
Now, the big question is who will no longer qualify for coverage, but we won't know until the House of Representatives makes their decision.